I'm talking to occupational therapist Joy Anderson today. Hi Joy, how are you?
Hi there, I'm good, thank you, Joanne.
Joy, we're talking today about autistic spectrum disorder. Tell me, what is an autistic spectrum disorder?
Okay, autistic spectrum disorder is a lifelong condition, and it affects people in the way their brain processes information. Generally, it's broken down into three areas of kind of difficulties with functioning. That's called the triad of impairment. So a person with an autistic spectrum disorder would experience difficulties with social interaction, with impaired communication, be that verbal and non-verbal. And then also difficulties with their flexibility of thought. So they would have sort of maybe quite a few stereotyped behaviours, restricted repetitive interests, and have difficulties with transitions because of that lack of flexibility of thought. In order for somebody to have an autistic spectrum disorder, the difficulties have to present before the age of 3, and actually ASD, autistic spectrum disorders, is on a continuum, so you can have people who are quite high functioning within the autistic spectrum sort of continuum, and that will be termed Aspergers syndrome, and then all across the long way, all down to kind of very highly affected autistic spectrum disorders. So it's a real continuum, and it's a spectrum, and it affects different people in different ways. So you've got the triad of impairment, but there might be different degrees within each individual who has it. It's a hidden disability in that you wouldn't be able to tell if somebody's autistic from looking at them, and it is a lifelong condition, but something that can very much be managed, and a person can be supported to still maximise their potential within life. Yeah.
What's involved in the assessment of someone with an autistic spectrum disorder?
From an occupational therapy perspective, we would be looking at engagement in day-to-day life and in functional activities, and about independence. So we might be looking at their skill levels, maybe some motor skills, perceptual skills, obviously communication skills are core, there's interaction with others, with their peers and with adults, looking at the person's skills, their habits, their routine, whether they've got an occupational balance within their life, so they're very kind of fixated on one area of one particular hobby or activity, and that they do that repetitively rather than having a broad range of that occupational balance. So the assessment would be looking at basically understanding that person, their strengths and their weaknesses, and how they both kind of interlink to make up that person, and what areas can be improved upon. So that would be probably what an occupational therapist would cover for supporting somebody with an autistic spectrum disorder. But then there will be other professionals involved who would look at assessing for other areas, and certainly for the diagnostic criteria, that would be other professionals involved in making that diagnosis and in providing support beyond that.
If we were taking somebody, a child that was suffering with Asperger's syndrome, what would be some of the things that would happen during a session?
Again, it's very individualised, because as occupational therapists we are looking at what the person wants to gain from day-to-day life, how their disability is affecting them, and what they want to achieve, what they want to engage with in day-to-day life. So it can be very varied. The children with autistic spectrum disorders, a big element can be about life skills, so preparing them for real life, and that might be in the community, working out how to engage appropriately within the community, so going on a bus, going to the shops, preparing them for those kind of things, because often people with ASD don't pick up on the kind of the social intricacies, so those skills maybe need to be taught rather than it being inherently picked up. So working on that kind of those kind of skill levels. It might be about working with the people around that child as well as the child to manage certain behaviours that are kind of more challenging. It also might be looking at their motor skills, their sensory processing skills, because those are areas that are often affected with people with autistic spectrum disorders. So again, that might be a focus within the intervention. It might be working with the families, with schools, supporting them to understand how they can then support that child and maximise their independence, maximise their engagement. Looking at the roles as well, because obviously with a disorder that affects your interaction, your social communication, your relationships and roles are affected. So looking at how those things can be improved upon, and that person can have an important role within their family, within their school life, making those social connections that are a lot more challenging, but are very rewarding when you actually get there with a child, and you can build those relationships together.
Thank you, Joy. Thank you so much.